Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, January the 4th, 2021. Happy New Year, everybody. Joining us today is Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg, and Toronto Councillor and Chair of the Board of Health, Joe Cressy. Mayor Tory.
Well, good afternoon, and Brad, thank you, and Happy New Year to you, Brad, and to everybody else involved, and to all of those who are joining us today. We are beginning this new year going into the second week of the province-wide lockdown, with the city itself in the 7th week of further reaching restrictions. It is also the 300th day that our City Emergency Operations Centre has been activated at its highest level to respond to this crisis. While the numbers of new COVID-19 cases continue to be alarmingly high, we know from our experience last year during the first lockdown that it takes time for these measures to have a downward impact on those numbers, beyond whatever they may have contributed to keeping the case count better than it might otherwise have been. Indeed, analysis published this past weekend showed that places which imposed more serious restrictions tended to be faring somewhat better during this second wave, even though the situation here is critical. The new cases we are seeing today are likely the result of transmission before Christmas. Even when we all stay home as much as possible, it takes weeks to see the results of our collective sacrifice. That's why it's so important that we continue to stay at home as much as possible beyond the holidays and into January. This will make a difference, this will save lives, and this will protect our healthcare system from being overwhelmed. I spoke to a number of people involved with the healthcare system over the weekend, and they describe a very serious situation. In the last week, there has been a 20% increase in people with COVID-19 being hospitalized, a 14% increase in people being admitted to the intensive care unit, and a 13% increase in people being intubated. And these are not all people that are in the highest age groups on the demographic spectrum. There are currently 18 active outbreaks in hospital settings, including patients, doctors, nurses, and other essential staff among confirmed cases. Now more than ever, we need people to stay the course and keep following the public health advice in order to protect each other and also to protect our healthcare system for those who need it most. And there's hope on the horizon. We began the new year with our frontline staff in our city-owned long-term care homes vaccinating almost 600 residents against COVID-19. This was a team effort between our city staff and University Health Network staff. There was no better sight on New Year's Day and New Year's Eve and this past Saturday than seeing photos of people being vaccinated at Cashel View Wychwood, Bendale Acres, and Fudger House, 3 of the city-owned and operated long-term care residences. I want to thank our frontline long-term care home workers for this effort over the holidays so that residents in these homes could be inoculated as soon as we had vaccine from the province. Approximately 800 city long-term care staff members have already been vaccinated with the Pfizer COVID-19 vaccine in hospital clinics, and we are working continuously to make sure the city is ready to support the province's vaccination efforts as they expand early in this new year. While the vast majority of the vaccine rollout is beyond the city government's control, I will be working with the federal and provincial officials, together with Chief Pegg and everybody, to make sure that it happens as quickly as possible. Just today, Premier Ford confirmed it will be full steam ahead, as he put it, on vaccinations, and they will be ramping up these efforts over the coming weeks, and we look forward to falling in behind them to provide the support that the city has asked to provide to this provincial effort. While it is good news that COVID-19 vaccines are here and being administered, we know the fight is far from over and spread is happening in workplaces. Even during the lockdown, we know there are many people who can't work from home. Today, Dr. de Villa will be detailing additional measures Toronto Public Health wants employers to take to help stop the spread of COVID-19, especially in workplaces. I urge all employers permitted to operate under the Reopening Ontario Act to do the right thing and follow these additional measures, including reporting requirements, in order to protect their employees and to help protect the health, ultimately, of all Toronto residents. This is about providing as much protection as possible to all of the hardworking people who are still going into work in person to provide for all the rest of us essential goods and services. These are recommendations based on the best public health advice that we have and will help keep people safe while ensuring that businesses and other organizations that are essential can remain open. Workplace outbreaks aren't good for anyone. They're not good for workers, of course. They're not good for their families. They're not good for our community, and they're not good for our collective fight against the spread of COVID-19. This is also why public health will now be publicly reporting these outbreaks. I believe this kind of transparency and public accountability will help to encourage employers to do everything they can to protect their workers, and it will help give everyone a better indication of where the COVID-19 virus is spreading in our community. Earlier today, I met again with the Greater Toronto and Hamilton area mayors and chairs who are also focused on preventing workplace outbreaks. We continue to urge, as a part of that as well, the provincial and federal governments to provide sick leave benefits for employees who test positive, as well as providing for increased workplace inspections to ensure public health compliance. No one should be afraid for their job or their paycheck due to a COVID diagnosis, a COVID test, or a COVID scare of any kind. And I think that it would be fair to say that after having asked for this, and we keep asking for it on the theory somebody will answer, that they have made provisions to make sure that no one is needing to be anxious in this regard, that we continue to await satisfactory answers coming from either or both of the other governments in this respect. The city is working to inform people of the benefits available to them and the job protections that are in place for them. Toronto Public Health is also recommending that employees are informed by their employers of income replacement and workplace-related benefits that they're entitled to if they have to isolate due to COVID-19 symptoms, when they're being tested for COVID-19, or if they're in close contact with someone who has tested positive for COVID-19. This is another example of action the city is taking to protect people from COVID-19 and to do everything we can to stop COVID-19 from attacking Toronto residents. And we won't stop taking action to help save lives and to protect the health of our city and its residents. Now I will ask Dr. de Villa to update us for today and to provide us with further detail on the additional workplace measures being implemented by Toronto Public Health.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 974 new cases of COVID-19. We have seen 3,061 new cases of COVID-19 in Toronto since the last time I reported to you in person on December the 30th. 366 people in Toronto are in hospital. 98 are in the ICU. Sadly, we are also recording 9 more deaths since yesterday. In total, 38 lives have been lost since December the 30th. The figures today are unquestionably a call to action for all of us. As individuals, we must take every action we can to protect ourselves from COVID-19 infection. Stay at home and stay apart whenever you can. Our goal in January must be to limit spread. Doing that relies in large part on us as individuals. To do otherwise is to surrender one of our most powerful advantages against COVID-19. Under the direction of the Board of Health, today, the COVID-19 dashboard will include new information to further illustrate the characteristics of the virus in Toronto. The website will provide more specificity about workplace-related outbreaks across 11 categories, including workplace settings like grocery stores, pharmacies, food processing sites, offices, warehousing, shipping and distribution, construction, and manufacturing facilities. Additionally, Toronto Public Health is implementing a system to share specific information about workplace outbreaks without compromising individual privacy. That information will be posted today and will be updated weekly on Thursdays. The criteria for disclosure include sustained transmission of COVID-19 in a workplace, where a significant proportion of staff have been involved in the outbreak, where there is significant duration of an outbreak, and where the workplace is large enough that the risk of privacy concerns are mitigated. Toronto Public Health has previously always identified businesses where a public health risk exists. The application of these criteria provide a basis for further disclosure as directed by the Board of Health. Whatever the specific figures, at this point in the pandemic, COVID-19 infection can be acquired anywhere and should be thought about as such. In Toronto, more than half of infections are resulting from close contact with a confirmed case. If COVID-19 gets into your home, it is very likely it will spread through your home. So the best thing we can do is to act to prevent it from getting there in the first place. Finally, Toronto Public Health is instructing all employers and businesses in the city to take additional actions and measures to reduce the spread of the virus. The most significant instructions include a requirement that businesses immediately notify Toronto Public Health as soon as they become aware of 2 or more employees with COVID-19, and to designate a contact person to work with Toronto Public Health and immediately implement any measures that are required by us. Employers are required to minimize instances where more than one individual is traveling in a vehicle associated with the work of that business. They must implement rigorous and frequent cleaning in all high-touch areas and areas accessible to the public, and ensure regular functional assessments of heating, ventilation, and air conditioning systems. Employers will also be required to ensure that physical distancing of employees by at least 2 meters takes place throughout the workplace where reasonably possible. As mentioned, employers are also required to ensure all employees are aware of any benefits and/or pay to which they may be entitled in the event COVID-19 makes it impossible for them to work as usual. These actions are meant to support employment, businesses, and the economy during the pandemic by supporting conditions where people can work and do business in safer and healthier circumstances. With more infection prevention and control measures, with more distance and clearer lines of accountability, there is greater capacity to manage public health while businesses operate in pandemic times. The one thing COVID-19 really can't endure is distance. These are distance measures in many respects. Distance of every kind is the greatest resource upon which we can draw in the next few weeks. Distance will produce results. The ability to create it lies within all our hands at this critical time. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. Today marks the 300th consecutive day of Emergency Operations Centre activation in response to COVID-19 in Toronto. Our teams continue to work in close collaboration with the city's senior leadership team and each division, agency, and corporation in response to the global COVID-19 pandemic. The enforcement of public health-related regulations has been a top priority for the City of Toronto since the outset of COVID-19. Our coordinated enforcement teams have been working diligently to enforce the regulations relating to COVID-19. The City has taken formal enforcement action 1,838 times to date in response. Since our last update, our enforcement officers have continued to monitor compliance with the Reopening Ontario Act. As a result of violations of the Reopening Ontario Act, 7 charges were laid and 9 notices were issued against owners and operators of retail stores, holistic centres, personal service settings, and pet grooming services. Enforcement staff also conducted 118 proactive inspections at restaurants and bars, with no violations being observed and no tickets being issued. Additionally, 20 charges were laid as a result of large gatherings on private property. This included a place of worship, short-term rental properties, gatherings on private property, and in private residences. Toronto Police also responded to 2 protests at public squares, resulting in 2 charges being laid. Unfortunately, we continue to experience issues with the use of outdoor ice rinks after hours and the use of closed ski and snowboard hills for various activities, including tobogganing. Our municipal licensing and standards team, working in collaboration with Parks, Forestry and Recreation and Toronto Police, continue to work together to support safe outdoor activities while protecting public safety. There is a full list of safe tobogganing hills on toronto.ca. We continue to be hard at work supporting the continuing implementation of the COVID-19 mass immunization campaign. Our immunization task force has been fully engaged on a daily basis throughout the holidays, and we continue to work every day to ensure that we are ready to launch mass immunization clinics as soon as vaccine is made available to us by the Province of Ontario. I'm also very pleased that City long-term care staff, in collaboration with Toronto Public Health and University Health Network partners, are making excellent progress in vaccinating the residents, staff, and caregivers in our city-run long-term care homes. Our immunization task force is working to support this important and life-saving work. We remain connected on a daily basis with General Hillier and the Province of Ontario's Vaccine Distribution Task Force, and will continue to work around the clock as we prepare for the provision of additional COVID-19 vaccine from the Province of Ontario. I encourage you to make toronto.ca/COVID-19 your first choice for information on COVID-19 in the City of Toronto. Thank you. And with that, I will invite Councillor Joe Cressy to bring his remarks this afternoon.
Well, thank you. Pegg, Mayor Tory, and Dr. de Villa. In September, our Board of Health asked Dr. de Villa to implement a system of sharing information on workplace outbreaks. Publicly reporting on workplace outbreaks, it's new for public health units in much of Canada. Traditionally, public health only reports an outbreak if there is an identified public health risk. But COVID is not a traditional communicable disease. Indeed, I think it's fair to say this is not a traditional time. So let me tell you 2 reasons why reporting on workplace outbreaks is important. First, transparency. By informing the public, we can help to inform behavior. And secondly, workplace safety. The data informs enhanced measures needed to keep workers safe. And by drawing attention to unsafe settings, we can hold employers and also governments accountable. And so in a pandemic, information is power. Information can also provoke change. When Toronto Public Health started collecting and sharing data on cases by neighborhood, it led to the establishment of pop-up mobile testing sites. When Toronto Public Health started collecting and sharing data on cases by housing status, it led in part to the creation of Canada's first voluntary self-isolation centre. And when journalists began reporting on cases amongst migrant farm workers, it led to action. And so our intention here is not only to inform, but to spur action to protect workers. In many ways, the story of this pandemic is also a story of work. To put it simply, if you were fortunate enough to work from home over the past year, you were less likely to get COVID. It's the essential frontline workers, the heroes we talk about, stocking our shelves, packing our online orders, delivering our packages, and taking care of our most vulnerable. It's those heroes, those essential frontline workers, who have often been at the greatest risk. And so until we collectively protect them, until we protect everyone, we won't truly beat COVID. And so for Toronto Public Health, that means continuing to scale up workplace protection. Simply put, where Toronto can act, we have and we will continue to do more. And as our mayor mentioned, for our provincial and federal partners who also have additional authority to enact workplace protections, this means continuing to do more as well, whether that's proactive inspections in workplaces or the provision and long need for sick leave and income supports to enable isolation. 2020, well, it was a challenging year. It tested this city, it tested our city like never before. And while the end is in sight with vaccines on the horizon, we are likely entering the toughest months of this entire pandemic. And so now is the time for all of us, individuals, residents of this city, and governments, each and every one of us, to fight with everything we've got to beat this. And to our essential frontline workers, to the men and women going to work each day so that others can stay safely at home, we will continue to do everything, absolutely everything in our power to protect you. With that, I'll turn it over to Brad to open it up for questions.
Thank you, Councillor. Just before we go to questions, just a reminder to please, reporters, unmute yourselves before asking your questions so we can hear you. We also have a number of staff on the line who can answer any detailed questions you may have. First up is Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. My question is for Dr. de Villa. Dr. de Villa, in light of your comments about distance being our greatest resource when it comes to COVID-19, I'm wondering how you feel about the decision to reopen elementary schools beginning on January 11th and high schools on January 25th. Is this a decision that should be revisited?
So, Francine, I think, throughout the course of the entire pandemic, it has certainly been my counsel and advice that we should constantly be assessing and reassessing our circumstances and adjusting our actions depending on what we actually see on the ground. When it comes to schools, as you know, this is a decision that does rest in large part with our provincial counterparts. But I think in the main, what I would say is that with schools, we have this very interesting balance that needs to be struck, and we have to observe that which has happened. What the experience has been, by and large, is that there is not a great deal of transmission that happens in school. What we are seeing is that as levels of COVID-19 activity in the community are increased, it is also reflected in our school system. So that's in the main. That's not to say that it never happens, that there isn't transmission, but by and large, the experience here in Toronto, and my understanding is that the experience is very similar in schools throughout the province, that what we're seeing within our school communities is more a reflection of that which is happening in terms of COVID-19 activity throughout the entire community. So, of course, there is an interest, and of course the objective is to run schools or any other places within the cities or within the province in as safe a manner as is possible. The issue, of course, with schools is that there are a number of benefits to having children, particularly younger children, attend school in person. So the real goal here is to try to balance COVID-19 control measures along with the benefits of in-person schooling for children. And I think that's the delicate balance and the situation that has to be assessed every single day by our provincial counterparts and certainly by all of us. That's, I think, a very reasonable expectation for us to have of those of us who sit at these tables, that we're constantly assessing, constantly observing, and adjusting actions as need be.
A follow-up question. You mentioned that there's not a great deal of transmission in schools. Is it that there's not a great deal of transmission in schools, or we're not doing the kind of, asymptomatic testing that would uncover the fact that, in fact, transmission is happening? It's just happening between people who are asymptomatic.
So, as more testing methods become available. There's certainly been more efforts put out in schools with respect to asymptomatic testing. But in fact, the investigations that have been done over the course of the fall here in Toronto, and my understanding is that this was the experience in jurisdictions all around the province, maybe not in every place, but in a number of jurisdictions around the province, when investigations were undertaken in respect of cases that were found in school, that transmission was not happening in the majority of cases in the school itself, and rather what we were seeing in the majority of cases was cases that were reflective of infection that was acquired outside of the school and that reflected the level of community spread rather than something happening in the school per se.
Okay, thank you. We'll go next to Austin Delaney from CTV News. Go ahead, Austin.
My question is to the Mayor and also Councillor Cressy. The Canadian Civil Liberties Association is calling for a reallocation of about $340 million from the Toronto Police budget. They want that money to go to mental health, to communities, to homeless, to youth in crisis. Mayor, Councillor Cressy, do you see this defunding as something that will ever happen?
Well, first of all, I get reports and submissions all the time suggesting that what is a very complex task that has to be done in a very careful, thoughtful way can be done overnight. I respect the fact that these are advocates, and I agree directionally with what it is they want to try to achieve, which is to find better ways in which we can address some of the needs of people like people with crises in their lives due to mental health issues and things like that, and it be done more by mental health professionals than by police. So what we're doing is very simple, and we're doing it with great determination and as much speed as possible, but doing it properly and carefully. We are looking at every task carried out by the police. We are looking for areas in which those same tasks might be better carried out by other kinds of professionals, including mental health professionals, for example. And then, and only then, once we've identified a better way to do this, will we reduce the police budget. And so I think that's the thoughtful, practical, careful way to go about this. We're doing it with as much speed as we can, but carefully. And that is the approach we will continue to take.
Well, and thank you, Austin, for the question. I will admit I haven't had a chance to read or review the report that you referenced, but I think the objective of our city and our community remains the same, which is how do we seek to support the residents in our city, especially those who are experiencing homelessness, those who are in a mental health crisis, in a manner that responds to their needs. And I think that's part of the important discourse that is taking place across North America and here in our city right now around reform and budgets. And that's a discourse that's going to carry forward. But I haven't had a chance to read the report, I'm afraid.
Follow-up, Mayor, do you see something like this happening in time for the next police budget?
I think we will bring about the task of reassigning tasks to people better suited perhaps to do some of this work, say with people with mental illness issues, away from the police as quickly as we can. But we've got to do it properly and compassionately and carefully. There's no point in us doing what some seem to advocate, which is just cutting money out of the police budget, when sometimes now they're the only people who are available to respond to some of these problems. So we will do this work as quickly as we can, and we will do it carefully, and we will do it with a view to finding the best way possible to support people who are in crisis or support people who need help. And if the police aren't the best way to do it, pursuant to this commitment to reform, then we'll find better ways to do it, and then we will reduce the police budget accordingly. But we can't do it the way that some people suggest, by waving a magic wand and assuming we can do it overnight. It's just not practical, and I'm not going to make promises that I can't keep, because my overall responsibility as mayor is to keep people safe, to keep people secure, and to make sure that we look after them as best we can. And we're finding better ways to do it as we speak.
Thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead.
Hi, good afternoon and Happy New Year. Dr. de Villa, I'm just wondering why you have decided to choose now as the time to address workplaces when, with the province's lockdown measures, workplaces have been a pretty big blind spot in the number of areas that are actually restricted there. Would it not have made a little bit more sense to do this before everybody went back to work? And I'm also wondering why there is no attention to some of the discrepancies that we see between large big box stores selling non-essentials in this number of new measures.
So Matt, a couple of things. Clearly the COVID-19 response has been a pretty significant response to effect for public health. So there are a number of actions that we've been seeking to take, and we've tried to ensure that we're focusing on those that are most relevant at that particular time. So we do have an opportunity. The opportunity presented itself. We do know that there are a number of workplaces that, of course, need to continue to operate. Even as we are in this phase of the pandemic. And so it made sense to us that we should seek to control risk and to, do the best we can to support the safe operations of these businesses now. And of course, as we move throughout the pandemic, this is not something that will just be of interest or of importance at this point in time. But certainly, as vaccines are deployed, as we start to move, hopefully beyond this wave and start to see a brighter component of 2021, these will continue to be important elements for the safe operations and the resumption of operations in as safe a manner as is possible for all of us in workplaces, essential businesses, and those that are perhaps not operating now, but hopefully at some point will be operating in the future.
And to follow up, the number of charges laid for gatherings, I think it's fair to say that in a couple weeks' time, we'll be seeing the extent to which cases rise because of that. I'm wondering beyond that, because we're into winter, because there isn't as much of a temptation to gather for the holidays, or quite simply because there's really nothing to do. Do you foresee that after we get through this next wave of infections from the holidays that things could perhaps peter off?
Well, certainly, I guess I can start with that, Matt. That's certainly our hope. I mean, clearly, all the way through the pandemic, our goal has been to mitigate the impact of COVID-19 on our community. And with that in mind, reducing the case count and reducing the spread of the virus has been always top of mind for us. So we are certainly hopeful that that will happen. And I would further suggest that as we have tried to make clear over the many weeks and months of the pandemic, and particularly over the course of this past fall, what it takes to actually reduce that spread significantly rests in our hands. To the extent that we are able to limit our interactions, to the extent that we're able to maintain our distance, to the extent that we are able to stay apart from those with whom we don't live, this is where we actually can really be incredibly powerful. And that will only be augmented as vaccines become increasingly available to the population. But it's still important.
Okay, thank you. We'll go next to Dave Woodward from Global News Radio. Dave, go ahead.
Thank you. Dr. de Villa, kind of piggybacking on Matt's question, many of these requirements, like keeping 6 feet apart, some rigorous and frequent cleaning practices, they were already well known to help slow the spread of COVID. So why haven't they been implemented until now? And how are these new measures going to be enforced if businesses don't comply?
So you're right. Many of these elements are good, solid infection prevention and control practice in the time of a pandemic. And these were certainly messages that were out there. So what has been put forth in writing and what will be shared with businesses and employers throughout the city, some of the elements are new and others are reiterations of good, solid guidance and advice now put in the context of the existing provincial legislation that exists right now. So, but I think that at the end of the day, what this is about is seeking to make workplaces and businesses that need to rightfully operate in the midst of a pandemic. Many of these businesses provide those essential services and supplies. You heard Councillor Cressy talk about workers that are actually doing things, providing services, providing goods and products so that we can go about our daily lives. So these are important businesses that need to continue to operate. And the question is, how do we make sure that we've got appropriate public health measures, that we're managing public health risk as best as possible, while at the same time ensuring that businesses are still able to operate as safely as possible in the context of a pandemic. And that's really what this, these instructions, these requirements are all about at the end of the day.
And I guess my follow-up would be for, I don't know, Mayor Tory possibly. How are these measures going to be enforced if businesses don't comply?
Well, I think in many cases, we've asked for the province to be stepping up the level of inspections in businesses generally, and I think that will allow an opportunity for somebody to be inside those businesses, looking at what's going on. And similarly, we have people that can do that upon a receipt of information that would cause us to want to do that. But let's not also forget the fact that a lot of this has to do with information those employers have to provide now to us, in which case, depending on what's provided, that can lead to, other visits and examinations of what's going on in those places of employment. But maybe Dr. de Villa wants to add to that.
Yeah, so I think, the mayor has covered it off well. Certainly we do take reports of situations that give rise to concern, whether it's members of the public or people within the context of specific businesses and workplaces. But, we have found in the main that people do respond and provide us with information, and they are following advice. And so we are entrusting our business partners and our employers and workplaces throughout the city to provide information as they are being instructed to under the current provincial regulation and with these new requirements in place. We will, of course, accept information from people if there are concerns around specific situations. We investigate those and we take action as is necessary. But it does fundamentally come down to each and every one of us in terms of trying to get that distance, trying to, do all those self-protection measures that we know work in terms of controlling COVID-19 spread. And yes, they are just as relevant whether you are, out and about, in a, retail setting doing something for your own purposes, or whether you're within a workplace or an essential business. Those self-protection measures work against COVID-19. It does fundamentally come down to distance and all those self-protection measures you've heard us talk about so often.
And if I could just add, the letter of instruction Dr. de Villa has issued very clearly requires all employers to take these additional measures. And it accounts for our ongoing collaboration and request with the Ministry of Labour to continue with proactive and step-up inspections. But none of this precludes our medical officer of health from taking specific and direct interventions for workplaces that aren't adhering, as our medical officer of health has done throughout this pandemic. So while these new measures are a requirement for all employers, and it does speak to increased inspections, where employers don't comply, our medical officer of health can and will take direct interventions for that specific workplace.
Thank you. We'll go next to Holly Mackenzie Sutter from the Canadian Press. Holly, go ahead.
Hi, just wondering about kind of more on that enforcement question. What are the penalties for kind of breaching some of the new rules, or is it going to be taken on a case-by-case basis? If you could elaborate on that.
Well, why don't I start? And, why don't we pick up where Councillor Cressy rightfully started off? If there are specific incidents with COVID-19 transmission within a workplace, and it is clear that the requirements of workplaces and businesses, as we've just described, are not being followed, that's a circumstance where we can use something like the Health Protection and Promotion Act and a Section 22 order. So there is a whole process for that, and it is actually specifically designated for the control of communicable diseases within the city. So that's the kind of action that we can take. But of course, as Councillor Cressy rightfully pointed out, we are expecting that businesses will comply of their own accord, because in fact, it just makes good sense for business to have healthy employees and healthy workers. And these kinds of activities, the actions and measures and the requirements that we're putting out there today are about creating the conditions that allow for the appropriate mitigation of public health risk and at the same time the safe operation of businesses, given that we are in the midst of a pandemic.
Great, thanks. And I just have one more question about the spike today. I know the mayor said at the beginning that we can't really say yet if it's directly related to Christmas, but is there a sense that it could be related to holiday gatherings kind of in the days before, or kind of any link to the holidays really with the numbers today?
So, with respect to the numbers today, the cases that we're seeing today were the result of infections that were acquired before the holidays. What might have happened over the course of the holidays will emerge over the course of the next couple of weeks. It does take some time before people present for testing and subsequent diagnosis with COVID-19 from the time that they actually get that infection. So we should expect to see that which might have happened over the course of the holidays, in the next days and weeks, in the coming days and weeks, I should say. However, it's still not too late. We can still do much to control the spread of COVID-19 in our city, and it does come down to staying home and staying apart as much as possible. That distance is what really does produce results. And the more we allow distance to do this work, the more we can actually take advantage of the fact that we can control this. We can actually determine how much distance we put between ourselves and others. The more the vaccines will be able to do their work as they become available for us. So I can't, state that enough. It is incredibly important, even now, to continue to maintain that distance.
Thank you. We'll go next to Mark McAllister from City News. Mark, go ahead.
Thank you. Happy New Year to everyone. Dr. de Villa, if we could start perhaps by maybe quantifying workplace outbreaks for us. Throughout this, it's been a vague number, workplace among other areas and places. Is this the reason why we're now having to see more reporting on the website and publicly because we didn't really know beforehand, or simply because you want more people to know?
I think, as you have seen throughout the course of the entire pandemic, we have always adopted new actions, including data reporting, in response to that which we see, in our community, and in order to better inform our response and to inform the behaviors of the residents of Toronto in protecting themselves against COVID-19. And so we are at a point in time, we are recognizing that there continue to be workplaces, essential workplaces and businesses that are operating. They are a particular place right now at this point in the pandemic where there continues to be some degree of interaction outside of the home. And they will continue to operate even as we produce, or as we go beyond this stage of the pandemic. So, and as we progress through the pandemic. So it seemed an appropriate thing to do in order to best manage risk as it exists right now in our community at this stage in the pandemic. And we recognize that it will continue to have value as we progress through the rest of the phases of this particular pandemic. So that's really our thinking. And you will continue to see us find new ways to respond to the outbreak, find new actions that we should be taking, because we're constantly looking for new and better ways to help protect the city against COVID-19 and its ill effects.
Maybe I'll word the question a little bit differently. How significant was the problem in workplaces up until this point? There was a point in the fall when the question about reporting on workplaces specifically was brought up, and you had said for privacy concerns you didn't necessarily want to divulge some of that specific information. So how bad has the problem in those specific areas been?
You know, Mark, it's an interesting question that you ask. I don't know that there's a very simple or straightforward answer. There are some areas and there are some workplaces that have had more challenging outbreaks. And there have been other workplaces that have gone completely unscathed, if you will, in terms of outbreak. I think that, as I mentioned, what we are trying to do here and what we have always tried to do throughout the course of the pandemic is to provide information when it makes sense, when we have a specific route that we can follow that clearly has benefit in terms of enhancing our response to COVID-19 and its spread in the city. So that's what we're doing here, and you will continue to see us constantly developing, whether it's data reporting or other courses of action to try to reduce the spread of COVID-19. We will continue to explore new methods and implement those that actually make sense for our circumstances.
Thank you. We'll go next to Angelina Kane from CBC News. Go ahead, Angelina.
Hi there. The website isn't updated yet, so I'm just wondering, can you give us a sense of what will look different for the public other than the 11 categories? Like what kind of information they'll be able to glean from the new website when it's updated?
So as the website gets updated, there will be the categories of workplaces, and we will have information regarding active outbreaks and the cumulative number of outbreaks within each of those categories of workplaces. So you will see that component on the website, and as well, there will be specific workplaces for which further detail will be provided, so that where those particular workplaces have met the criteria that I described earlier this afternoon in my remarks. Specific workplaces where there has been sustained transmission, where there's been a significant proportion of workers that have been impacted as part of the COVID-19 outbreak within that workplace, where there's been an outbreak of significant duration, and for those workplaces where there is not as much of a privacy risk given the size of that workplace. So those specific workplaces will be identified in our website on a week-by-week basis as we update the information on the website.
Thank you. Since it's not updated yet today, do you have information for how many workplace outbreaks there are currently in Toronto, and then the cumulative total as well?
So I think, if I remember correctly, and you'll have to forgive me here, so I don't have the cumulative total right now. I do believe in terms of active outbreaks, the last I heard was 16.
Okay, thank you. We'll go next to Mike Walker from CTV News. Mike, go ahead.
I apologize, sorry. Thank you for taking my question, and Happy New Year. Just kind of piggybacking on what some of my colleagues asked earlier, why now? Are we seeing still significant outbreaks in workplaces? Where do workplaces lie in terms of where we are seeing transmission?
So I guess what we've done, as I've tried to explain, is that when we have provided new actions or taken new actions in the pandemic, it has always been in response to that which we are seeing in our community. And given that we are at this point in the pandemic, and given that we are within a lockdown under the provincial framework, there are only a limited number of places in which we are seeing interaction between individuals, and that's the circumstance that gives rise to COVID-19 spread and transmission. So we have been working on this for some time now. It does take some time to sort out data issues. These are challenging issues to try and provide clear, cogent information to the public on. So we've worked hard on making sure that we're providing information that is reliable and can help to inform both us as public health officials and the public in terms of what they can do to best protect themselves and to limit their interaction with areas of public health risk. That's always been our our goal in terms of taking on new actions, which includes data reporting. So at this point in time, recognizing that workplaces, essential workplaces, need to conduct their business. They're important in terms of providing the goods and services that all of us use on a daily basis. But because they're out there, and many of them do require in-person sorts of work, it does continue to be a source of transmission for COVID-19, as is any activity that happens or that involves you leaving your home and interacting with other people. So we feel that it's important at this time to provide information and to make sure that businesses and workplaces are also being instructed to take the necessary actions to reduce the risk of COVID-19. As I've indicated, that's been our goal all the way through. What actions can we take? What measures can we take that actually reduce the spread of COVID-19 in our city? And this is one of the things that can be done to enhance the safe operation of businesses and essential workplaces at this point.
And if I could just add, Toronto Public Health, since the beginning of this pandemic, has been amongst the first in the country when it comes to data and reporting, whether that was on cases by neighborhood in our city, by income, by race, by housing status. And it's always been with the objective that collecting data, that's not the point. Using the data to inform Toronto Public Health's response to protect Torontonians, that's the point. And so to the question of why now, I would say from a Board of Health perspective, it's about our commitment to constantly scaling up and improving our response every day, every week, every month. And I think that's what Dr. de Villa and her team have done since the beginning, and we will continue to do.
And just as a quick follow-up, just seeking a little more clarity on terms of enforcement. I know the expectation is that businesses will comply, but who's going to be enforcing this? How will we be following up, making sure businesses are following through on these measures?
Well, certainly as Toronto Public Health, as we become aware of circumstances within workplaces and workplace outbreaks, we are following them up. Now that we have this requirement of employers, we expect that we should hear from employers and businesses and workplaces when they've got 2 or more cases of COVID-19 so that we can help them address whatever risk might exist within their workplace. But as well, we have received reports from the public all throughout the course of the pandemic, and we follow up on all of those in order to do the best we can to mitigate risk. And finally, as you've heard both myself and Councillor Cressy speak to, should there be specific circumstances where we see that there is a communicable disease risk, and in this instance, we're talking about COVID-19 risk within a workplace, and if businesses or employers are not taking appropriate action to reduce the risk of transmission of virus, then we have the option of using our existing powers as public health under the Health Protection and Promotion Act. But we do sincerely hope that employers and businesses really appreciate that the safe operation of their business, the safety and health of their workers, is of course important to a safe and healthy business, and it's part and parcel of their responsibility. I think the only other point that I would make is that over the course of the pandemic, I will say this, that the team at Toronto Public Health has actually increasingly worked in tandem with our colleagues at the Ministry of Labour and ensured that, when there are circumstances that clearly do warrant their intervention and that have to do with those elements that are under their purview and under their jurisdiction, we're making sure that they're aware of it. We're advising them of circumstances if there are concerns so that they can step up their inspections and do what they need to do from their perspective as the Ministry of Labour Training and Skills Development.
Okay, thank you. We'll go next to Sarah Mostahedzadeh, and I apologize if I mispronounce your name, Sarah, from the Toronto Star. Go ahead, please.
Thank you. This question is really for all 3 of you. You talked about working in tandem with the Ministry of Labour. We know that as of mid-December, the Ministry of Labour had only issued 1 fine to an employer for COVID-related workplace safety violations. Are you satisfied with the response, if you've received any, to your calls for stepping up inspections as well as other measures like paid sick days, who, are the responsibility lies really with the provincial government. Are you happy with the response you've received?
So what I can speak to is the nature of our interaction as Toronto Public Health with Ministry of Labour staff. And what I've heard from my team is that they've had a very productive relationship with the representatives with whom they meet from the Ministry of Labour Training and Skills Development, that there has been a lot of conversation and a lot of partnership around what can be done within the context of workplaces and businesses in order to enhance safety, and in particular, to enhance safety in the context of COVID-19 spread, transmission, or outbreaks. So I know that that has been a very positive working relationship. I can't speak to all the other aspects of the Ministry of Labour and its functioning, but we certainly have been, pleased with the nature of cooperation and collaboration and the growing cooperation and collaboration that we've experienced with this ministry over the course of the pandemic.
For my part, can I indicate that I am content that the Ministry of Labour has, from early on, allocated significant additional resources to making sure that workplace inspections are carried out with greater frequency, and that there has been the cooperation that's been reported by Dr. de Villa between the Ministry of Labour and Toronto Public Health. I am not at all satisfied, nor can I tell you are my mayoral and regional chair colleagues from across the region, at the fact that we've not had some response, some specific response from either the provincial or the federal government, both of which have the means and the responsibility in one way or another to provide for those who are anxious about getting tested because they're afraid they will lose their paycheck. And I think that this is something that is very important to a number of people who would just not go and get tested and in fact go to work sick and can cause a workplace outbreak inadvertently because they're afraid of losing their paycheck. And I think it's time that we had action, past time, that we had action on that.
And finally, Sarah, on my part, I think it's fair to say that protecting the health of frontline essential workers requires more from all levels of government. And I think we've spoken to a number of those pieces here today, whether that's the provision of sick leave, as the Mayor just indicated, or the recently announced efforts by the Ministry of Labour to strengthen and enhance inspections. That's a welcome move, and we'd like to see that. But all levels of government need to continue to do more because our essential workers deserve that.
Thank you.
You have a follow-up, Sarah?
No, thanks.
Okay, thank you. We'll go next then to Lucas Meyer from News Talk 1010. Lucas, go ahead.
Thanks, Brad, and a happy new year to everyone. Hope you're all feeling well and doing well. Dr. de Villa, you mentioned in the beginning there, and I think this is just a point of clarification about ensuring privacy. And I think you mentioned something to the effect of, making sure a workplace is large enough for that to happen, just something to do with size, in order to make sure that, personal information isn't, jeopardized in any way. So can you just, in a nutshell, kind of clarify what you meant by that? Is it possible that, maybe smaller businesses, either some sort of, like a mom and pop operation, might not have the same sort of requirements with these rules? Can you just kind of clarify that part from your opening?
Yeah, so Lucas, it's not about the rules. The rules and the requirements are required of all employers and businesses. What we're talking about is the disclosure of further details in respect of specific workplaces and their outbreaks. And in that circumstance, we're talking about workplaces that are having outbreaks where there is sustained transmission or a significant proportion of their workforce is impacted, or where, for example, you see a long duration outbreak, which demonstrates, again, that ongoing and sustained transmission, and therefore increased risk associated with that outbreak. The issue with those is that if you're going to get into very specific disclosure, if the workplace is small enough, so for example, only has 3 or 4 employees, as would be the case in a mom and pop shop, as you described, Lucas, by virtue of the fact that there's an outbreak, I am by definition, identifying people and therefore disclosing personal health information. So in those kinds of circumstances, we wouldn't be able to disclose because we would be by definition violating the personal health information or the privacy of those individuals and their personal health information.
And so maybe just a quick follow-up on that, and then over to Chief Pegg, Dr. de Villa, maybe just a quick follow-up. Like, can you describe what the threshold is? Like, is there like a specific number of employees to protect against that? If you can answer that. And just really quickly, Chief Pegg, the numbers you mentioned there, the 20 charges, I believe that would be from December 30th to now. Do you have, though, an educated guess on what that fraction is compared to how much people did gather in their private homes over the holidays? There's just such a big concern, you know, people getting together over Christmas, et cetera. Could you make any sort of estimate on how small a fraction that is compared to what, you know, really happened over the city?
There's no way for me to do that whatsoever. I have no sense. I have no information other than the information provided to us by our coordinated enforcement team. So I would be hazarding nothing more than an uneducated guess. So I won't even try.
Okay, and Lucas, back to the first part of your question. At this point, as we move forward with this new reporting regime, we're looking at workplaces roughly at about, you know, if they're larger than 20 employees, we're considering that large enough that we're not concerned around privacy violations or inadvertent privacy violations. But of course, we're constantly assessing and reassessing, you know, the means and the criteria on which we're disclosing, so as to be able to provide the best information to the public and to inform our own actions and response as we seek to control COVID-19.
Thank you. Final question is to Miriam Edahia from the CBC. Miriam, go ahead, please.
Hello, can you guys hear me?
We can, yes. Go ahead, please.
Thank you, Brad. Hi, everyone. Happy New Year as well. My question is in French for Mayor Tory. Bonjour. C'est pour parler de la réduction du budget de la police de Toronto. Allez-vous considérer une réduction du budget allant jusqu'à 340 millions de dollars?
Ce n'est pas une tâche simple comme suggéré. Nous examinons maintenant actuellement les fonctions de la police et examiner les possibilités de remplacer la police et peut-être employer les professionnels comme les professionnels de santé mentale pour répondre aux situations dans la ville de Toronto. Et ensuite, et alors seulement après identifier les opportunités de remplacer la police, maintenant réduire le budget de la police pour tenir compte de ce qu'elle ne fait plus. Mais seulement après identifier les opportunités de remplacer la police.
And as a follow-up, est-ce que ces initiatives seraient communautaires seulement ou ça serait des partenariats avec la police de Toronto?
Je ne comprends pas la question. Répétez, s'il vous plaît.
Perhaps I'll say in English, would these be community-based initiatives only, or would there be in partnership with Toronto Police Service?
Les opportunités que nous allons identifier maintenant, ce sont les opportunités de changer la méthode pour la police, mais nous allons identifier les opportunités avec les organisations communautaires, comme les organisations de la santé mentale et les autres. Et ce sont les opportunités pour la police, mais si nous allons identifier les autres opportunités de performer les fonctions du gouvernement de la ville de Toronto en meilleure façon, ce sont une grande opportunité aussi.
Thank you very much, and thank you for joining us. This concludes today's briefing. Our next scheduled update will be this Wednesday at 2 p.m. Stay well, and again, Happy New Year, everybody.